So our project was on the use of Chinese herbal medicine in diabetic populations by us. So let's move on to the essential historical and social content. Traditional Chinese medicine has been used to treat diabetes mellitus for more than 2,000 years. Chinese herbal medicine has been essential in the alleviation of symptoms in diabetic patients. Chinese herbal medicine is known to be clinically effective, relatively safe, and has fewer side effects than traditional Western medicine. Xiao disease is the term that the Chinese use for diabetes. In traditional Chinese medicine is characterized by excessive drinking, excessive food consumption, excessive urination, and weight loss.
Yin and Yang concepts of traditional Chinese medicine. In Chinese culture, the yin and yang are seen as two opposing but complementary forces. Yin deficiency leads to issues like dry mucosa, a common occurrence in diabetes mellitus. The main therapeutic methods of Xiao disease are invigorating qi, energy, nourishing yin, the positive force, clearing away heat, and alleviating various symptoms such as thirst, another symptom in diabetes mellitus. Heat-clearing herbs. These herbs have the ability to control the blood glucose by inhibiting inflammation. And we have two examples, Huang Lian and berberine.
Now we're going to be going over some of the treatments which reduce the risk for diabetic ketoacidosis in patients with type 1 diabetes mellitus. Diabetic ketoacidosis is a common negative occurrence with diabetes. Compared with non-traditional Chinese medicine users, researchers found that the traditional Chinese medicine users displayed a 33% decreased risk of diabetic ketoacidosis. Diabetic ketoacidosis risk decreased to 42% for patients who received a longer treatment with traditional Chinese medicine. One example is ginseng, which increases insulin sensitivity in type 1 diabetics, as well as protects against streptozin-induced destruction or chemotherapy of pancreatic tissue and restores insulin secretion. Mu Dan Pi is another example, which simulates glucose uptake and glycogen synthesis in vitro or in testing or test tube. It prevents diabetes-induced vascular damage and reduces diabetic nephropathy or destruction of the kidney's nephrons in a streptozin-induced diabetic rat model. Huang Qi, commonly used to reduce diabetic symptoms such as fatigue, and astragali extracts, which are used for tonic effects and prevention of skin breakdown, which is very common in diabetic patients.
So here are some advantages and disadvantages of traditional Chinese medicine. Some positive aspects of traditional Chinese medicine will be lower rates of toxicity and side effects, holistic regulation of metabolic problems, as well as reversal of risk factors leading to type 2 diabetes mellitus and delaying diabetic complications. So here are some disadvantages. We have herb-drug interactions, which can be dangerous, and we have the potential for poisoning if these herbs are misused. We have adverse reactions to traditional Chinese medication injections, and there is some conflicting evidence by researchers that suggest that maybe some of these herbs might not be the best for human use. How to prepare, support, and educate a patient about Chinese herbal medicine. Well, it is essential to educate patients on the effectiveness and the use of herbal remedies over the past 2,000 years. There's a host of evidence that's over the years that's been accumulated that shows the benefits and the usage of traditional Chinese medicine. It's not just a recent occurrence in history. We must also reassure patient doubts about interactions and toxicity of herbs. Also, giving proper dosages and routes of administration is essential. We also have to make sure the patient's family is aware of herbal remedies and its interactions, as they are vital to many of the patient's management of diabetes mellitus. Families should be aware of what's going and what they are taking, so in the case of emergencies, they are not surprised, or they know what to do. We must also make sure the patient checks with primary healthcare provider, because unapproved use of herbal remedies can be legally binding.
Also, you want to make sure that the patient is consistently monitoring blood glucose and reporting any adverse reaction caused by the ingestion of the herbs. So basically for this, you want to catch anything before it becomes truly detrimental to the health of the patient. Here are some cultural competency goals to be presented to the healthcare professionals. One goal that should be achieved is bringing exposure to the use of herbal remedies, as well as removing the stigma defining traditional Chinese medicine as primitive or unscientifically based. Basically, we don't want it to be ignored, rather research further. Consistent research has shown that herbal medicine can alleviate target systems and is also relatively safe, contrary to popular belief. The use of non-traditional methods should not be a medical taboo. The results seen in diabetes mellitus patients should be replicated and researched further. All in all, we shouldn't throw out this use. This is a beneficial medical use, and research should be replicated rather than thrown out.
So here we have a plan for intervention. So the medical diagnosis of type 2 diabetes, we must provide basic safety and comfort measures to the diabetic patient, such as thermal socks to promote warmth and peripheral circulation.
Here's some more treatments for traditional Chinese medicine. Some of the herbal medications, such as Luo Tong, which activates blood and unblocks the collaterals. San Huang Tong, which is a bitter taste to oppose the sweet flavors. Bang Shi Tong, combined with Suye Huangling Yin, which relieves nausea and vomiting. And Wei Ying Zhan, which lowers blood uric acid.
We also want to ensure the patient develops a daily schedule of ingesting herbal medications. They have to take finger sticks before their meals, and we also have to educate patients on the contraindications of complementary and alternative medicines with Western medicine.
To reinforce this, surveys will be done beforehand in order to provide data and support for the treatment. Direct observation in a clinical setting will be appropriate to ensure that the patient is following the care plan and improving with treatment. Basically, you want to see a first-hand occurrence of this treatment. And again, to reinforce this further, interviews can be also given afterward in order to provide a subjective account on the effects of herbal medicine and a beneficial treatment plan for others. And here are references.